If you were to ask anyone to list the top 3 most important things in life, you'd find one word showing up on everyone's list: health. Whether on our wish list or thankful for list, health is always there. Thus, it is not surprising to see healthcare on the criteria list of many in the decision-making stage of becoming an expat. It certainly was on my list before I relocated to Turkey. And the consideration was not only for my own benefit, it was for my 10-year-old daughter and spouse. Actually, it went even further than that. For us, the healthcare issue was about finances as well. Allow me to explain. For the past 6 years, while living in the United States, my daughter and I were paying a total of $800 per month for health insurance coverage. That's right, a whopping sum of $800 per month. More or less $10,000 a year. And you know what? This amount for 2 super healthy individuals with 0 pre-existing illnesses or health conditions and no family history of any health problems. Wait, there is more. This $10,000 a year paid to one of very few health insurance companies in Oregon. Oregon state requires that you use Oregon-based insurance companies, was the cheapest, the lowest price we could get. Because we, my daughter and I, each had to have $7,000 deductible policy. Meaning, no matter what happened, we had to pay the first $7,000 out of our own pockets. And only after that, the health insurance company would pay our medical costs. Yes, you heard that right. We, the 2 of us, with 0 pre-existing health issues and only for major, catastrophic medical emergencies, were paying $10,000 a year for 6 years, during which we were never reimbursed for any medical costs. Because, you may say luckily, we never incurred any medical bill over $7,000 for any illnesses. Here in Turkey, the medical care, which is considered very high quality based on global standards, is free to all citizens, to include my expat family members, non-citizens, and be eligible to receive extra benefits from private hospitals as well. I have to pay 65 Turkish lira per month, a meager $12 a month. Think about it, $12 per month, $800 per month. No deductibles, no BS, top-notch facilities, state-of-the-art equipment, stellar doctors with qualified degrees per international Western standards, all that for free for citizens, and $12 per month for expat families. Can you imagine my relief when I was able to cancel that income-sucking $800 good-for-nothing USA health insurance? Oh yes, we even celebrated. During the last few years, Turkey has been ranking as one of the world's top medical and healthcare tourism countries. I will provide you with a few links in the show notes. In 2017, more than 700,000 medical tourists came to Turkey for services. Let me give you a few examples. The cost of an angiography is $47,000 in the United States, $13,000 in Singapore, $11,000 in India, and $10,000 in Thailand, while $5,000 in Turkey. Cardiac valve surgery is $150,000 in the United States, minimum. and it is $17,000 in Turkey. And check this fact out. Most of these medical tourists are coming to Turkey from Europe and Russia, not third world countries. When compared with Europe, in Turkey, the average patient's waiting time was a maximum of 2 weeks, excluding transportation. But this process could reach 18 months in European Western countries. And here is one more impressive fact. Turkey has been ranked as the third country when it comes to the quality of medical standards and care. Third, and this is the entire world. And all these costs and related facts that I provided you pertain to foreign tourists coming to Turkey for medical care. For Turks, the cost is basically nothing. The waiting time pretty much does not exist. Here in Turkey, healthcare is health services, a fulfillment of one of the most basic human needs. Unlike the United States, where healthcare is a business, a very, very, very expensive business with ludicrously high profit margins. Now, let's listen to my British expats friends, Terry and Jane, with direct experiences with the Turkish healthcare system for expats for the past 13 years. So he drove you to the hospital.
And he said the symptoms, and I was giggly, just like I was drunk. So I said, I'll be okay in the morning. And then I got up the next morning, I sat in the chair and I thought, I don't feel right. My daughter phoned up and she said, are you all right, Mum? I said, no, I said, she's your speech is funny. I said, I think I've had a stroke. She said, oh my gosh, she said, get Dad to take you to the hospital straight away. I said, oh, I'll tell him when he wakes up. He was in bed. Anyway, I woke him up and he rushed me straight down, didn't you? They're marvellous. But they took me straight into the emergency and one of the interpreters came straight away and was talking me through, telling me what they were doing and why they were doing it. And so you've got to have a brain scan and, oh, scary.
MRI?
Yes.
They put a tablet under your tongue straight away.
Yeah.
Oh, for heart attack? That's for heart attack, the tablet.
Well, no, it's for stroke as well.
Oh, so it works for both? I didn't know that.
It worked anyway.
Because, you know, if you feel a stroke coming on, you put the tablet under your tongue.
They knew right away that it was stroke. And what did they do next?
I can't really remember much.
Well, no, you wouldn't. I remember it quite well.
Took me up to, I had that done, I went up to the ward and they just treated me from there.
Kept you in observation for
a week. 5 days.
5 days.
In the hospital? So you were overnight patient?
Yes, 5 days.
It was the attitude of the people. We're not used to the whole structure being quite so fast. We're used to a different system where really here you get treated like you matter, whereas previous experiences, our system in the UK is a bureaucratic nightmare, which I think is the same pretty well all the Western world now.
Yeah.
Too many chiefs, if you like, not enough Indians. Some extraordinarily good, caring, professional, able people buried under a pile of paperwork and stuff. But here, so quick. And when you're not well, and I'm with Jane, remember in a foreign country, don't speak the language, don't know what to expect, to see people taking the situation and dealing with it so thoroughly, professionally and thoughtfully was a huge relief. I thought, what am I in for here? Am I going to have a funeral coming up? I'm going to fly back to the UK? What's going to happen?
The main physician who was in charge during your stroke, he was a specialist for, okay.
Dr. Suleiman.
And he had what, years of experience, younger doctor? Did he speak English?
No,
A little, but not.
a little, but not, not enough to
Not
translate.
technically, no.
I know it's going to sound, I don't know, maybe shallow, but that's important for me as well. What kind of, at the end of the process with this, what kind of bill did you get? Was it like, what, I'm just going to guess, $50,000?
No.
Nowhere near.
Nowhere near.
$20,000?
No.
No, it wasn't 20,000 lira.
Did you have insurance?
No.
No, because we'd only been here 9 months. Not that, 6 months.
6 months.
And if we had the government insurance, the first year you can't claim.
As residents, right. So you had no Turkish insurance?
No Turkish,
And
no.
your British system wouldn't cover here?
Oh, no.
So if we were to convert this amount to dollar, are we talking about like $5,000?
No.
Less, more?
I don't remember exactly how much it was for that. I mean, I remember some of the costs.
7,000 lira, was it? No, 3,000 lira.
I can't remember what it was now, but I remember the cost, because Jane has been to the hospital many times with various other problems. And I do remember how much that cost. That particular occasion, a stroke, I just paid. Didn't think about it. It wasn't a lot of money.
$2,000?
I think it was 3,000 lira.
That would be like $500, $600?
Well, the exchange rate at that time was about $3.30 to the pound. So
Okay, so still would be $1,000, let's say. And this included the MRIs.
Oh, yeah,
How
okay.
many MRI sessions did you have? Only one? And staying in the hospital for a week?
you weren't there a week.
About 4 or 5 days, that's all.
4 or 5 days.
Were you there as long as that?
Medicine, IV,
Not really been as
Yeah.
long as that.
blood tests,
Oh, yeah.
urine tests.
Yes, everything.
So you had blood tests and urine tests and MRI and about 4 or 5 nights and days of hospital stay and the specialist. I have a question. This is an example because I'm sure in Europe it's not that bad, but in the US, as they take me or my husband into the emergency room to the MRI room, whoever is the spouse, the administrative people, they grab and they say, show how much money you have, your credit card and everything. So while you were going through this as foreigners, expats with no insurance here, and you're in this amazing modern hospital, did they grab you to say, we're going to give her all the services? How do we know you can pay for her services or not?
The subject came up.
Okay.
Have I?
Yes, thank you.
Got it all?
Yeah, no.
So what if you were not able to pay, say, well, right now, this month, I don't have this money?
Now,
I don't know.
Never had that experience, I couldn't tell. But as residents, we have emergency treatment anyway, including our residency.
In Turkey?
Yes.
Yeah, we have free
Emergency.
ambulance, free emergency treatment. You have to pay for the medication, but not for the staff. Because Jane collapsed on the market, for example, after your cancer operation, wasn't it? And called the ambulance took her to the hospital, we put her in the emergency straight away, no messing about, no form filling or anything like that. Well, she was known to them anyway, she was a regular. And all we had to pay for was the drip, which was about 80 liras.
Honestly, what was your confidence level on the, let's say the doctor, the specialist? Did you feel confident saying, this man knows what he's doing?
Oh, yeah.
Yeah. Yes and no. Because I was scared,
Of course.
really, what he was saying. And I thought, ugh,
How about after the fact, after you went through?
fine.
Oh, yeah.
No problem at all.
Well,
All the doctors here, all the ones I have dealt with, I've got 100% faith in them all.
They haven't let you down.
No.
always takes the time. Doesn't happen in my experience in European hospitals, well, particularly British ones. Getting the appointment is the biggest challenge. It might take 3 weeks, it might take 6 weeks, whatever, to get.
Our problems in the U.S. is the
Yeah,
cost.
I went down to the hospital earlier in the year. I walked in, went to the tourist office. I saw the consultant. This was without appointment. I saw the consultant an hour later. Had some tests, and I was out again. Got the medication, came home. So in a total, just over 2 hours. I'm relieved. Problem identified. Problem solved.
Well, I just received my own shock. I was, my daughter and I in the States, we have been paying $850 a month for insurance, the two of us as a family. And each one of us having $6,000 deductibles, $6,000 for her, $6,000 for me. Thankfully, I never had anything serious that went beyond that, but on the other hand, for 10 years, the insurance has not paid a single penny because I've never met the $6,000. Everything goes out of pocket, and if you don't have it, you don't get it.
I can tell you the figures actually with Jane's cancer operation. That was 3 years ago in October, the operation. And the actual operation itself, the room cost, I seem to remember, was 14,000 lira. At that time, the exchange rate would have been about 350, 360 to the pound. So when you consider quite complex surgery, ICU afterwards, and then room costs, and then of course return visits, I wasn't complaining about that.
For my season 2 of Bridge the Gap with Sibel Edmonds, I would like to delve further into healthcare related topics, our universal need, and the right to humanitarianism, human-based healthcare is a bridge that connects us